Hi everyone, and welcome to this orientation of trainers on SPEL webinar. I am Camille Donna. I am the Child Rights Governance Global Theme Research and Evidence Advisor, and I will be co-facilitating this webinar together with Ansi Hassanali, who is the monitoring specialist with Save the Children Sweden. A couple of ground rules before we start. If you are not talking, please mute your microphone. We will have a Q&A session at the end of the presentation to answer your questions. So please write any questions you may have in the chat box. Alternatively, you may speak at the end of the presentation. And this webinar will be recorded for further use. So we will start with the presentation. And see if you can change slides.
It doesn't work here. Yeah.
Thank you. So here you have the outline of the presentation today. We will browse through together with you on what is SPEL, what are the main challenges in CRG meal, why SPEL for CRG, where we stand with SPEL, and how to train on SPEL. We will then dive into the various SPEL processes and tools. There are 4 key steps in SPEL implementation, from the strategic thinking and strategic thinking diagram to the pathways of change and pathways of change flowchart, to monitoring for dynamic programming and learning for dynamic programming. We will then conclude the session with 2 overviews on how to integrate SPEL in meal systems and how to plan for SPEL together with country programs and country teams. And see if you can change slides. So what is Hi, can you hear me? Hello? Can you hear me now? Yes, perfect.
Yes.
So I was saying SPEL is a new set of processes and tools to help you plan, measure, document, and learn from the change processes involved in working towards a child rights objective. And while we will delve into the specific steps and processes of SPEL later during this presentation, just want to highlight the series of processes and tools. First of all, to improve strategic thinking on CRG, advocacy, campaigning, and other programs. A second set of processes and tools to improve program planning towards reaching a child rights objective. A third set of processes and tools to dynamically monitor program implementation. And the last set of processes and tools to dynamically learn from program implementation. And as I mentioned, we will introduce each of these processes in detail further in this presentation. If you can change slide, Ansi. What are some of the challenges with CRG meal, or what is the background with SPEL? SPEL was developed by the Child Rights Governance Global Theme in close collaboration with Save the Children Sweden to answer some of the shortfalls or challenges that were noted in evidencing results and outcomes of CRG programs in the short to medium term. Indeed, CRG programs did not, in general, have a large body of evidence on the short to mid-level, soft, hard changes brought about by them. Furthermore, CRG programs often failed to demonstrate their contribution to changes. As you know, creating positive changes in the structures and institutions of governance so that they work effectively to deliver children's rights take time, because we work to change the root causes of CRG. We work to change the structures and the systems of governance so they work effectively to deliver children's rights. As such, big system changes such as policy changes, changes in the constitutions to account for child rights, adoption of Child Act or law to ban child marriage or physical and humiliating punishment. All these are very large changes, and we needed to understand and document better what happened, for instance, what happened at the immediate and mid-term level. For instance, with various stakeholders, we try to influence before these big system policy changes happened. And as you also know, sometimes it's difficult within CRG advocacy campaign programs to know how these changes will happen, as there are many variables, factors, and actors that come into play. So is it particularly our work, or is it the work of our work associated with the work of others, or is it a particular enabling political, socio-economic environment which created the change? So we struggle to demonstrate our contribution to the change. So yes, we operate in a very complex environment. We also had to deal with a very rigid framework for assessing results and impact. Lock frames often lock projects and programs into one path to change, whereas in reality there may be different change pathways we need to explore and learn from to reach our ultimate goal for children, for the fulfillment of children's rights and ultimately to improve children's outcomes. Another challenge we were confronted with is linked to causality. It's difficult to know if it is our actions that led to change happening because of the complex environment in which we operate. SPEL focuses on our contribution to change rather than an exact causality of actions and change. So contribution rather than attribution. And also we mentioned CRG change, advocacy change takes time. We have an example of work carried out by CRG teams in Nepal, where a change in the Nepalese constitution was achieved to better promote children's rights in 2016 following 7 years of advocacy. But what happened in the meantime? What kind of soft, hard changes could the country office or the CRG team have focused on to demonstrate results and changes in the immediate to mid-term level? Ansi, if you can change slides. You have an illustration here of how lock frames lock programs in one pathway to change, with a linear causal relationship between inputs and activities which lead to a certain set of outputs, which lead to expected outcomes and expected impact. Whereas, if you change slides, Ansi, in reality, there are many pathways of change a program will go through, and specific, especially CRG or advocacy work, before it reaches its ultimate end goal. Yes, thank you, Sarah. I have borrowed that diagram from you. If you can change slides, Ansi. So why SPEL for CRG? What the monitoring, evaluation, and learning systems for CRG lacked to date were a better strategy program design tool to assess more comprehensively what to do to change the child rights situation, with whom, using which path or which tactics, and for which outcomes for children. So SPEL and the first process of SPEL will help you think more strategically about what to do to improve the child rights situation. Then those M&E systems lacked a better planning tool, looking at all conditions or paths or tactics that can be implemented to reach an end goal, a program end goal. SPEL, through its second process or step, will help you plan your programs looking at all conditions or tactics to reach this change and adapt your programs if these conditions or tactics are not proved to be working. Also, these systems lack dynamic monitoring to track whether these conditions or tactics were coming together, were working, and adapt program if they were not. So SPEL will help you dynamically monitor how the conditions, the tactics come together and adapt if they don't. And finally, those monitoring and evaluation systems lacked systematic ways to document and learn from program results, program progress, successes, and setbacks. So SPEL, through its last process, will help you document and learn from successes and setbacks. Ansi, if you can change slides. So as I mentioned, we have some solutions through SPEL. SPEL helps you ensure your strategic plans are designed to reach your objectives and end goals for children, to improve the child rights situation, the fulfillment of children's rights, and improve children's outcomes. SPEL helps you monitor implementation and change processes and adapt your interventions should other pathways be needed to reach your ultimate goal. SPEL supports you to more systematically collect evidence throughout implementation. And I'm aware that I'm highlighting on I'm putting SPEL in the context of CRG, advocacy and campaign, because these were initially the program work and the theme that SPEL was designed for. But SPEL is a methodology to document changes towards any child rights objective, whether they are aimed at improving rights to health, rights to education, protection, or other rights. And therefore, SPEL is useful to support meal systems irrespective of the themes. And that's why I'm very happy that we have some representation from other global themes today taking part into this webinar. Next slide, please. Where we stand with SPEL currently, we have 2 focal points for SPEL, Anzi from SC Sweden and myself. And obviously, as we are aiming to further roll out and socialize SPEL this year, this is probably not enough resources to do so, hence your convening to this webinar today. Concretely, SPEL has been piloted in 2 countries with CRG programs in 2016, Zambia and Peru, and successful SPEL products developed in these countries. SPEL has also been introduced to the Pakistan and Bangladesh CRG programs through in-country orientations. Save the Children Sweden integrated SPEL components in the CEDA 2017-2021 programmatic framework for CRG and child protection. So SPEL components are part and parcel of the reporting framework for the CEDA framework agreement, which is a great achievement, and also which showcases that SPEL is elementary to not only CRG but also other thematic programs. We have been socializing SPEL in a variety of fora through the CRG annual learning meetings in Asia and the Middle East and Eurasia region, through the global meal meeting, face-to-face meeting last year. We've also this year have strong interest from a certain number of countries for SPEL trainings or orientations, specifically from China, Ethiopia, Vietnam, Nepal, MEE, and SRO offices. And there is an interest from our colleagues from Norway in integrating SPEL or some of the SPEL components in the reporting framework of the new NORAD framework agreements. I also wanted to highlight that CRG results, as reported by country programs in 2016, offered a richer picture of intermediary changes, for instance, build relationships with government officials, shifting attitudes or behavior among our stakeholders, considerable contribution to child rights policy solutions or implementation, which can be partly attributable to SPEL socializing in 2016. And since we have here today our colleagues from the global advocacy and campaign team, I also wanted to highlight that they have very much used the SPEL methodology and approach to not only to support progress and results documentation within within advocacy and campaign programs, but also use SPEL to develop the new advocacy and campaign impact monitoring tool as part of the CAR process, which has replaced the AMT tool. So I would very much like to thank my colleagues for that. And this again showcases the wide reach SPEL has had so far. But so we have this ambition, if you can change slide, Anzi, to further roll out SPEL, socialize SPEL across the organization, across SCA, so not only within CRG programs and certain members supporting, but also, you know, getting more members on board with SPEL, supporting us, socialize SPEL, orientate on SPEL, train on SPEL, provide technical support, continue technical on SPEL, and further integrate SPEL in program cycles, not only within CRG advocacy and campaign, but also within other thematic programs. So that's why you are here today, and that's why we very much need your support and your human resources. Next slide. So how to train on SPEL. So this webinar focuses on orientation of trainers. We need more trainers. We need more technical expertise, technical support on SPEL. And so we have highlighted some of the key elements to be able to enable you to provide orientation and training or trainings on SPEL. When to train on SPEL? SPEL is best introduced when new strategies for CRG, advocacy campaign, or other thematic programs are being planned. However, strategies can also be revisited and improved using the full SPEL cycle. The first component of SPEL is a strategic planning process where program teams, partners, and key stakeholders answer key questions related to what they want to do to improve the child rights situation, what difference it will make for children, how to achieve the change, and what are the key assumptions and risks linked to the strategy to track. So this strategy planning process, of course, is best applied when a new strategy is designed. However, it can also serve to revisit existing but perhaps failing strategies. What we highlight as a second point is SPEL does not necessarily have to be used as a full cycle methodology or approach. It can also be used, part of SPEL steps can be used depending on the program modality, depending on the stages of program implementation. The next element that we want to highlight is the fact that the SPEL tools development must be a participatory process. There are power analysis, strategy developments, there are pathway of change that will be built through SPEL and that are best built with the stakeholders that know the power dynamics, the external environment well. And these are our partners, these are our government counterparts, these are our staff, of course, these are program participants that need to be involved in the SPEL development processes. We also need to, when we orientate and train on SPEL, we also need to dispel the very common myth that SPEL is an additional meal system. SPEL is not an additional meal system. SPEL complements SCI's meal framework. We often get questions during SPEL training on the potential duplication of SPEL with SCI meal framework. Then there is no duplication. Program teams will still complete proposals, budgets, logical frameworks, results frameworks, meal plans, IPTTs, donor SCI reports as set forth in SCI's meal framework. SPEL tools support program planning and design. SPEL tools support program monitoring, and SPEL tools support learning. They do not duplicate these processes. You will see in the SPEL, we try to steer clear of sometimes very cumbersome meal jargon to make the processes more easily understood, but this element needs to be clarified with the teams that are orientated or trained on SPEL. Furthermore, prior knowledge on programs is key. Should you orientate or train, capacity build on SPEL, we recommend that you obtain as much information as you can about the program's training participants work on before the orientation and training. Because while SPEL will be applied to a whole program within the CRG or advocacy or other thematic interventions, for the purpose of the training or the orientation and the SPEL product development, you will have to focus on one area of work to manage time and ease of understanding. Next slide. All right. A final background note on SPEL. This is how SPEL integrates within the meal cycle. So SPEL has 4 key processes and tools. The first one is the strategic thinking process and the strategic thinking diagram, which is applied at the strategy setting stage. The next SPEL process or tool SPEL process is the pathway of change, and the tool is the pathway of change flowchart, and is applied at the meal planning stage. The next set of processes and tools is the dynamic monitoring and the various tools that are linked to this process, and relates to the monitoring and accountability and to some extent evaluation stages within the meal cycle. And the final process relates to learning for dynamic programs, which relates to the evaluation/learning use of findings stage of the meal cycle. This is the background that we wanted to give you on SPEL. Anzi will now take over and introduce you to the first 2 steps within the SPEL methodology. Thank you.
Yeah. So now what we'll focus on is this session 2 on so you've gotten a background knowledge about what SPEL is, but now how do you implement SPEL? The steps that Camille discussed earlier, the 4 steps, how do you actually make it useful, make it practical, and integrate it within your program cycle? So I'll go through those steps right now. So the first step of SPEL is the strategic thinking diagram. And I think this is the most important step because often the obstacles to successes are traced back to planning. And a lot of times it is that our planning is not adequate, or a lot of implementation modalities have not been taken into account, or you cannot specify in terms of what success looks like. So there's lack of clarity about what is it that we're trying to achieve with our programs. There's lack of clarity about how different activities contribute to... Hello? Hello? Okay. So, all right, thanks. So, yeah, there's lack of clarity about how different activities contribute to reaching objectives. Then there's lack of clarity about how to measure progress and evaluate impact. So you plan something, you're like, okay, you identify this is the goal, but then how would you reach that goal? What is the current context looks like? What are the complexity that are there? What are realistic timelines, or what are realistic expectations based on our experiences and everything? And then it also reflects back on inability to innovate or be flexible and respond to opportunities. A lot of times when we have very rigid planning, it's like, okay, one thing will lead to the other, and something will happen, a miracle will happen. So it's often that all of these complexities are not taken into account from the onset of planning. So this is the key, that you can't separate the planning and monitoring, evaluation, and learning together. You need to keep the 2 close, and that's why it's called SPEL and not, dispelling the myths that meal and planning is not something that is separate. It is something that is together and needs to be taken into account as well. Because a lot of times what we see is indicators are planned, but there's no sense of how it is being measured, or why is data being collected, or what is the use of those data, and what is the use of collecting a lot of information. So a lot of this falls back into how it's being planned. This is a simple diagram, but yet it tells us a lot about thinking programmatically around our different approaches. So if you look at this diagram, what it shows is there's children, there's at one end there's policies, and then there's one end asking for rights. And what this overall diagram shows is that within our strategic thinking diagram, you need to work on all levels. When we work on demanding child rights, when we ask, build capacities, build systems, build knowledge, and then on the other hand, we want that, okay, all of this goes back to children, goes back to changing in children's lives. So at one hand, you're asking for, increased resource allocation, looking for budgets, looking at budget analysis. But what are you doing that is like this resource allocated is being spent on children, and what is, so you have to link it back in terms of what are you demanding child rights, responding to child rights. And that circle in the middle is basically the space for that negotiation. Do we have the space? Is there a mechanism that supports that dialogue or not? So it is a very simple diagram, yet it tells us a lot around the overall programming modality and things that you need to take into account. And further on, I'll even give you examples on how this actually looks like in practice. So what this strategic thinking diagram helps us to do is looking at, because what we start from is looking at, and this is a usual process in the planning cycle. You start from problem analysis. There's a child rights situation analysis. There are child rights governance assessments. There are different sort of need assessment or situation analysis. So it's something that departs from all of these analysis, your experience and knowledge about the situation. And it helps us to develop strategies looking at all key conditions or tactics to reach a change, which is basically based on your prior assessments. And there are 3 key child rights governance change dimensions that you need to consider in your strategies, which I reflected on earlier. So demanding child rights in that way, negotiation, space for negotiation for that, and responding to child rights. And the expected changes for children is the end goal. And what you do is you look at these 2 arrows. So the language that SPEL uses for these 2 arrows are working both upstream and working downstream. And what is the difference between those? So working upstream is that you work to build systems, you work to build capacities to deliver child rights. And looking at the downstream is, are the changes in the policies or the rights that are demanded are implemented to ensure that it reaches children? So in one way, you're negotiating for resource allocation, and then there is a civil society is involved, the community is being involved. But on the other hand, you need to see that that resource is allocated, is being spent on children that way. So you need to look at all of these dimensions while you're looking at your strategies. And this could be whatever strategy. It's not necessarily relating to child rights governance, but it helps you to think programmatically in terms of, okay, there is good governance system, but it's not being implemented. There are good laws in place, but the laws are not being implemented. So you need to work on that modality. There are 4 key questions that will help you rethink your strategy, or the questions that will guide you in terms of your program, in terms of your planning. So the first question is what, and this is not only when you're developing your strategy, even when you're developing your program proposals, you're developing any program. What you need to ask is, what change do you want to achieve to improve the child rights situation? That's the first key question. What is the change? What is the program going to achieve? What is your strategy all about? And while asking that question, there are 3 key child rights change dimensions that you need to look at, that I've been talking about earlier. So demanding child rights are all the actions with right holders to empower them to claim their rights. We work on empowering citizens, we work on empowering communities to hold the states to account. On responding to child rights are all the actions with the duty bearers to make them aware of more receptive and responsive to children's and other right holders regarding child rights. And is there adequate space for negotiation on child rights? All the actions to create space and mechanism for that engagement, for that dialogue between children, civil society, key actors. What is that? And all of this comes from our child rights programming approach. So it's nothing different, but it just puts that as a question that you need to look at these things when you're developing your strategy, when you're developing your program. The second question that you need to ask is, what difference will it make for children? So, okay, why are we doing things? Why are we Why are we doing this sort of a program? What difference will it make for children? So that's the question that you need to ask for yourself within whatever dimension. So a good Save the Children programming, advocacy, or campaigning strategy will identify which tangible changes will be achieved for which children as an end goal, in line with our breakthroughs on survival, learning, and protection from violence. So that's the second question that you need to ask. The third question that you need to ask is how to achieve this change. Rather than asking for, okay, what are we doing to achieve this change, activities and whatever, you need to ask, okay, how are we going to achieve this change? And what is our strategy that is working on both these dimensions, working both in terms of improving capacities, engaging duty bearers, making sure that all of this is reflected back to children. So you need to identify the how element. And while you're doing that, the important thing is to identify what are the assumptions and risks associated with this change. So rather than, identifying each and every activity and identifying risk associated with that, you need to look it in terms of a broader picture. So this is the change that we want to achieve. This is how we are doing it. And right now, given our assessments, given our experiences, given our knowledge, given our previous evaluations, given our assessments or analysis, this is the complexity to achieve this change. These are the enabling factors to achieve the change, and these are the hindering factors. So you identify that from the onset of it. So it takes into account a complex child rights environment. It is necessary to factor in assumptions and risks related to the external environment, which will later be monitored. What often happens is we often fail to document what happens if our assumption goes wrong. So what if we had planned for things but it didn't go the way they were supposed to be? So would we need an alternative approach for that? Would we need to change our strategy? Would we need to change our programming modality or things? Or we keep on doing the things as we're doing? So it reflects back to, you have to plan it that way that it is adaptable to changing context, changing complexities. And that often refers back to planning. So if you have a good planning and if you've taken all of these things into account, then you're like, okay, if our assumptions are not true or if our assumptions go wrong, what is it that you need to do? So these are the 4 questions that when you revisit your program, when you revisit your strategy, or when you develop a new program, you need to ask these 4 questions. And this is an example to show how does this look like. And after that, what I'll show is a practical example of how we've integrated the strategic thinking diagram into a proposal development process. So what you have here is in the upstream work on working on capacity building, capacity and lobbying of children. So you identify these intermediary changes in terms of demanding child rights. Then you identify the spaces for negotiation. Who are you working with? What are your actors? How do you connect the community's children to the duty bearers? And how do you ensure that the duty bearers or the one that are responding to child rights respond in the way that you're supposed to respond? So work with children and partners to build formal mechanisms for states' engagement or improve spaces for children. So that's the space for negotiation. And for instance, the downstream work, the arrow that goes down, is working on looking at these expenditures in children's sector to ensure that whatever increased resource allocation is, it is reaching the intended target group. And ultimately, what you would want to see is that the program wants to see strengthened good governance for children's rights and better outcomes for children. So this is just a simple way of sketching out when you're thinking of developing a certain proposal or when you're developing your strategy, just to sketch out what are those intermediary changes in those key child rights dimensions that we need to take into account. So now I'll just give some practical examples because it's often very useful to connect the whole theoretical behind how you can actually integrate this step in your program proposals or in your modality or in your different strategies. So So this is the first example of one of the proposals that we worked on in Middle East, and we've seen this diagram. It's a child rights programming approach where we look at, you know, the children in the center, then there's families and caregivers, communities and civil society, national level policy and practices. And when we're looking at both working on demanding obligations and responsibilities and claiming rights. And in this way, what we could do is we could have, when we look at change in this level, we're like, okay, what is the change that we want to achieve for adolescents? What is the change that we want to achieve for family and caregivers? What is it that we want to achieve with the civil society? And what is it that we want the government or the duty bearers to respond to? And then you have your programming modality around it. And then you have your change objectives in relation to that. And then how it is translated into the strategic thinking diagram is, it could be your theory of change for the program. It could be a strategic thinking diagram could be translated into the whole programming approach in relation to what your theory of change looks like for that program. So here, if you see in terms of demanding child rights, it's around the adolescents' capacity and knowledge and understanding of their rights, and the connectors in their communities. They understand how to protect themselves. They make use of child protection services and their employability and technical skills. So it gives in terms of the intermediary changes that we need at this level. In terms for space for negotiations and provision services, we have working with communities, civil society organizations to advocate. So this is the middle level, where is there a space to provide that? Is there a mechanisms or a space to connect the two together? And then on the other hand, what you see is in terms of responding to child rights. So we've created the demand, there is a space for negotiation, but are the effective institutions, mechanisms protecting and promoting the children's rights? And then you have intermediary changes in relation to that laws are being implemented or improved quality of services, existence of mechanisms to enable children and communities to exercise their rights. And in return, what it is, the goal is that, so it's the child rights objective is that, okay, we want the adolescents that are affected by these crises are resilient and act as an agent of change. They're valued, they're protected from violence, there's a legal reform. So this is a practical example of how you can demonstrate your strategic thinking diagram into looking at all of these angles when you're developing your programmatic approach. So this is one example of putting this planning into practice. And what we have in relation to all of these steps is you have to identify risk and assumptions. And that is separately, that you have to take into account that while achieving this change, we have certain risk and assumptions based on our analysis and assessments. The other programming modality that takes it into account and giving a practical example of the strategic thinking diagram is looking at it in terms of how a results framework, because often we're like, okay, we talk about this approach, but how do we put it into our log frames, or how do we showcase it to the donor, or how do we put it in terms of what would our outcomes look like, what will our objective look like, how will our results framework look like, how can we monitor our progress in relation to all of this? Because yeah, it looks very good in terms of theory, it looks really good in terms of a strategy, but what is it when it comes to the practical way of working around it? So if you look at this program, this is the program, the CEDA Civil Society Organization program that we've developed for 2017 to 21, in which we've inbuilt this in terms of the results framework approach. So you'll see here that it's the same modality of looking at it from society, civil society, and empowerment. So at one level, what you want is changes in policies, practices, and attitudes, and make sure that the citizens' voice and participation is in public decision making. At the space for negotiation, you have the civil society's capacity to empower, mobilize citizens, convey voice, and advocate. And at the other level, you have empowerment of individual and children. And if you see these arrows, they're traced back. So it's not only going from one to the other. It's like, okay, how are these policies reflected? How children that have participated in decision making actually, they've been heard, their voice has been represented, and it leads to actual changes in policies. And in terms of a results framework approach, how could it look like? So your objective, the first question that you need to ask is how we want the situation for the children to change. And that could be your objective, and that could be your goal. And in terms of outcome in relation to that, what is it that you want is changes in policies, practices at a societal level. What is the change that you're looking at in terms of when you're looking at different outcomes and different components of the program? A civil society civil society strengthening and empowerment of individual and children could be your intermediary outcomes to achieve that change. So the capacity to empower, mobilize citizens, convey voice and advocate, empowerment capacity of individuals and children. So all of this strategic thinking diagram could be translated into your results framework. And this is one way of doing it. There could be a lot of different ways to do it, but this is just to give a practical example of how this could be translated into your lock frames or into your results framework. And so what our main component of this results framework contains is the objective, the intervention logic, and the strategy. So the strategy asks those questions that you saw, those 4 key questions. How would you achieve the change in relation to the outcomes? Identifying the pathway of change. And this is the second step that I will go into much more detail on how to develop the pathway of change. And while describing this change, you need to take into account risk assumptions. You need to also take it into account the specific contribution. And what Kimel earlier mentioned as well is like, we're not looking at, a lot of focus on attribution, but when we're looking at long-term changes and everything, we need to see how we've contributed to the change. What is Save the Children's role towards change? What are the partners' role towards change? Or how we've worked along with different stakeholders to achieve this change? And that is much more important than just focusing on attribution. So this is one practical example of how you could integrate step 1 into your results framework, step 1 into developing your theory of change for the program, and there could be many ways to do it. And as mentioned earlier, it's not like you have to use the whole SPEL cycle into your program. It's like where you find it relevant and how could you work around it. And the important thing here is planning. If it is planned right, and if things are taken into account in the right way, then the other steps become useful and helpful for you as well. One thing as well, since this is also an orientation for trainers, our experience from piloting this approach in Zambia and also working on training of different people on SPEL, I think it's important that you give in some time to that. When you go through the strategic thinking diagram slides with the participants, you could decide on an area of focus within your child rights governance work or within your child protection work. Just focus on a specific area. You could split participants into different groups that look at all of these different child rights dimensions, and what you need to ask them is to answer those 4 key questions to develop and strengthening their child rights governance strategy. And normally it takes 1 hour when you work on this sort of presentation. And then in a plenary, you discuss and ask them to place these answers in the strategic thinking diagram and all of these questions, so that you relate. How does it relate to each other? What does it mean on demanding child rights? What does it mean in responding? What is the space for negotiation? What is it that we know and we need to focus more on? So, and there are different tools that you could use to actually introduce the step. And you can use these practical examples, but when you work on it, a lot of different issues come up, and you can focus on a specific area of work rather than focusing on everything. So it's really important that if you're working with this, or if you're training people on this, rather than overwhelming a lot, focus on a specific area and try to make it practical. So this is the first step implementing SPEL. The second step of SPEL is around planning with pathways of change. So what is it in terms of planning? And I will show you a visual demonstration of looking at that. So what is a pathway of change? It's an extended version of a change theory. So it's nothing different than your theory of change or looking at your intermediary changes. It's just an extended version of your theory of change, but it helps you to look at intermediary changes and external influences. So, and what it shows is a causal linkage between your activities, your outcomes, and what your project is trying to achieve. So rather than just fixating ourselves on activities, and then in the end just having a checkbox exercise of if the activities are completed or not, you rather link it up to where you want to reach, what is the change that you want to achieve, and link different factors to achieve this change. And while you're linking that, you need to identify what are the external factors. And here, the importance of control and influence comes into account. So what is it that is in your control that you can complete and be like, okay, we've done this. We've done the capacity of, we've trained these many people on child rights. But what is it that you would want them to do differently? So you need to go to the next step. And that is the step that you need to, that identifies your critical point. That, okay, you've done something, but whether it has resulted in something or not, and based on that, if you would want to change your pathway, that is very critical. So step 2 defines how you can actually plan with pathways of change. So it helps us to be clear about the steps needed to achieve the change. It helps us to verify the connections between what you will do and what you want to achieve. It also allows you to test whether the planned activities actually work to produce the change. So you've done a list of activities, but are they actually helping you to move forward into your program, or you need to adapt your program? So in the end, it also allows you to review progress and adapt in case your predefined pathway does not work. So it takes complexity into account. It takes context into account. So there's a constant need for updating the pathway of change depending on if it works or if it doesn't work. So rather than pre-designed activities and pre-designed strategies, you need to be wary of the context, and you need to vary about the external influences. And also you need to be wary about the opportunities, because a lot of times there are opportunities arise that are not part of the proposal development, or they're not part of the program development. For instance, you would want to work on getting some legislation, but then there's an opportunity that opens a window of actually, steps towards that legislation are taken in place. Then you need to adapt your program based on, rather than advocating for this legislation, is actually make sure that legislation or change in law is being implemented and how you respond to that. So you need to be wary about program modalities, both on opportunities and also on external influences that hinders your path. So how do you basically develop your pathway of change? Is you start from your strategic thinking diagram. And that is the core element of your flowchart. So you start with your planning. So that's your planning tool. So you look at that planning tool and then start from that and add, and I'll show you what are these different specific shapes to your flowchart. And why we're looking at flowchart here is also to give it a visualization. There could be many different ways of planning with pathways of change. You could write a narrative around it, or you could write, you can write a story around it or something. But the specific way in terms of using a flowchart helps you to actually visualize how things lead to the other. So, I'll show you how that works. The other thing is, the second step is to think about the intermediary changes which your program will achieve, all the critical steps to reach your end goal. So you need to identify the critical junctures that are there that will help you to achieve those goals. So what are those intermediary changes that needs to happen, or that needs to take into account, and that you visualize from the onset. Think about alternative tactics or paths to reach your critical juncture in case the initial one does not work. So when you're planning the program, when you're developing your pathway, you need to take into account, okay, this is our strategy, but if this doesn't work, then we need to do something else. And what is that something else? So you plan it accordingly. So it's like if plan A doesn't work, you have a plan B to work on it. Or if you need to adapt, what is it that you need to adapt? And consider your program's assumptions and risks. So based on your current analysis about the scenario and everything, you need to add program's assumptions and risk into these flowcharts, and then add specific shapes to your flowchart. And I'll introduce those shapes and what they are. So rectangle basically shows the activity. So it's like an arrow shows the connection between these different events. So one thing leading to the other, and that's the arrow. What I mentioned around the intermediary changes is this diamond, and that is your critical point in developing this pathway. So these diamond will show if you move the next step, and this is also where you do not have entire control. You have control over completing a set activity or something, but these diamonds are a lot where okay, you've built capacity of children to do something, but whether they are doing that or not, that's something that is not in your control. And that reflects back to, was your activity adequate enough to actually make this happen or not? So these diamonds are the critical points, which are the intermediary changes, and they help us to assess the program performance. And these if-then logic needs to be applied here. So the alternatives needs to be taken care of when you're looking at these diamond shapes. That, okay, if this doesn't work, then what do you do? How do you change your plan? If things doesn't work, what are the options? And this also may be a good point for your review meeting, for your learning meetings, to check if your diamonds are actually helpful in terms of you moving to the next step or not. The clouds in this are basically the influence. What are the external factors, or what are the opportunities or the challenges? So you take that into account from the onset. So these are just to demonstrate what are those specific shapes represent, and you'll see those flowcharts in the next slides as well. The key principles when developing your pathway of change is a generic pathway helps you visualize a whole program. So it helps you to visualize, okay, this thing leads to this, and this is the critical juncture, these are the intermediary changes, and in the end, this is what we want to achieve, while looking at these influences and everything. Then you could also have specific pathways, and those specific, depending on how detailed you would want to be. A specific pathway, for instance, how a different actor changes, or how a pathway for, children achieving something, or a pathway for civil society's capacity being strengthened and they doing something. So there could be a specific pathway for different actors that are involved. And what also helps with developing a pathway of change is to breaking the different parts of your program into components. It can really help you to identify all the necessary changes. So whether you have different outcomes towards achieving your end goal, you might want to break all of these outcomes separately in order to identify all the necessary conditions in relation to that. The key point is that diamond shape, which is your critical juncture, which are your intermediary changes, based on which you can alter your pathway or you move forward with your pathway. In describing the pathway of change, you will need to discuss and agree assumptions in how change happens. So when you're describing it, you need to take into account what are those external influences, what are those clouds that needs to be taken into account. The pathway should anticipate how the situation of children will change as a result of your intervention. And the other underlying principle is it should be simple, yet broad enough, but as the program is being implemented, you can adjust and add details. So depending on, and this is a very good diagram to demonstrate this. So it says, look, this opens a new possibility for action. Let's revise our pathway or take advantage of that. So as your program is being implemented, things might need it to be adjusted, the details might be taken into account. So those are the key principles to develop your pathway of change. I'll just give one practical example from our pilot in Zambia, just to show what it is. I won't go into details of what it is. You will get the presentation and all around it. But this is just to show that how this flowchart is developed. So you have a starting point, then you have a certain activity, then you do something, and then there is a diamond that shows, okay, this is something that is not in your control, but something that would help you either to move forward or you need to go back. So if you look at those green arrows, it's like, okay, if this happens, then you go to the next step. But if it doesn't happen, then you need to revise your strategy. Then you see those clouds around, which are the influencers or which are the external influences. So you would see within all of these, there are some points where things are in control, and when there's some points that you need to reflect and revise on your strategy. If things go according to your plan, you might move to the next step. But if it doesn't, then you might need to change or adapt your pathway. So this is just one example. I won't go into details of what actually each and every step demonstrate, but this is how a generic pathway is made. And in the end, your expected result is improved health outcomes for children. But to reach that, there's a lot of different modalities that you need to take into account. And these critical junctures, so for instance, there are 6 critical junctures here that are really important, that will help you to assess where you are in your pathway. So this also helps in terms of when we discuss step 4, in how a review meeting could be planned, how a learning meeting could be planned, how your program planning will be adapted based on that. And it gives like a visual demonstration of where we are within our program objectives, where we are within progress towards achieving our goal. So this is one way of looking at it. Then there's this another example just to show it's not a simple process. You know how when we saw the diagram in the earlier, it's like one thing leading to the other and other. It doesn't happen that way. And these are the specific pathways. So you look at these 4 charts which we developed in Zambia when we were doing the pilot. So it's like, okay, change with respect to communities, change with respect to engaging children, change with respect to engaging civil society, and a generic change. So you could even be as specific as possible, or you can be generic depending on your program modality and what is it that you would want. So these are some of the practical examples of how a pathway of change is made. And I really wanted to show this example, this picture, because it depicts that, you know, often the whole aspect of meal is being understood as, you know, it's too technical, it's something, yeah, there are some technical aspects of it, but as a program person or as in the community, children, when we're talking about participation, everyone should feel comfortable with that. The community should know that, okay, this is our program, where are we? They could be able to monitor and evaluate that if the program has been able to deliver what it was. And this is one example in which one of the community members are using this approach in terms of their child protection committee and what changes do they want with respect to a child protection committee. Where do they start from and what do they want this child protection committee to look like? So in this way, this approach is very participatory. So children could be involved in developing this. The communities can be involved. It could be specific for one committee to the other committee. So there are different modalities that and people, what we saw from the pilot and when what we got the impression from, people found it useful in terms of they could visualize where they are and how change is being achieved, rather than looking at a list of indicators or rather than looking at the list of outcomes and objectives. This gives like a programming approach. Okay, this is where we are, this is where we want to go, and this is the steps that we take along the way. Oh, but these are also the external environment or the complexities that we need to take into account. So in order to practically, in order to make this work, when you were working with participants on developing these flowcharts, you could go through these slides with the participants and then break down the area of focus into key program components or expected outcomes. So you can work on one specific component or one specific outcome, and then you could assign a group to each of those components. So what each group could do is to develop a specific pathway of change for those assigned outcomes. And in a plenary, there could be a presentation about the flow charts and how one thing leads to the other and what are the critical junctures. And in a plenary, what we did in Zambia, for instance, is like we brought all of these outcomes together. It's like, okay, but how do all of these outcomes contribute to what is a generic pathway of change? What is it that this program intends to achieve, rather than looking at specific outcomes? And that is where you could come across and make like a generic pathway of change. So even if there are different people involved, there are different thematics involved, or there are different partners involved, you could actually come together and see, okay, where do we all correspond to this, or where do we all see that? And then you can use pre-made shapes or flip charts and stuff to actually demonstrate how this happens. So this was basically the first and the second step in terms of planning the strategic thinking diagram and how to plan with the pathways of change. And now I think Camille will take on to talk about how to actually monitor using SPEL. How do you monitor these pathways of change? Yeah.
Thanks very much, Anzi. So we're reaching now the step 3 of the SPEL process. So we have now developed a comprehensive strategy to towards reaching our child rights objective and children's outcomes. We have, through the pathway of change flowchart, envisaged all conditions, tactics, paths necessary towards reaching our child rights objective and improving children's outcomes, including, as Anzi very rightly mentioned, identifying those critical intermediary changes, critical junctures that will tell us whether we are on the right path towards reaching this ultimate child rights objective, or modifying, adapting our tactics, our program interventions if we're not. So now we need to know what progress is being made, and the step 3 of the SPEL approach focuses on this element. How do we monitor using SPEL? We are setting forth 2 simple processes to enhance our storage, documentation of progress and results and the changes that we're bringing about. One of them is setting indicators, and the other is the use of a very simple progress tracker to document progress, results, changes in the short to the medium term. Change slide, please. So with regard to setting indicators, why and what kind? Well, we're setting indicators for accountability purpose to document that we are doing what we said we would, and to document that we're making progress, but also for learning and improvement purpose, to adjust with our strategy and to learn about our assumptions and the operating environment. As I mentioned before, SPEL does not replace traditional meal processes, i.e. log frames, results framework, meal plans, and so on. So in the indicator results framework development, indicator setting stage, program teams should develop, output and outcome level indicators using, for instance, the thematic menu of outcome level indicators that the global themes are developing and will roll out soon, or output indicators using the flow chart and identified activities. Where SPEL's value addition is in developing 2 specific sets of indicators, context indicators and progress markers against the key intermediary changes or critical junctures identified in the pathway of change flowchart. If you change slide. So first of all, you remember in the pathway of change flowchart, we have this cloud shape external influences, which we need to be aware of, and we need to keep a mind of, and we need to track in order to assess how they might influence positively or negatively our program. So what we call context indicators are those concrete measures of the external influences represented in the cloud shape in the pathway of change flowchart. They relate to the external influences which can affect the pathway we hope to see unfold. They can be both challenges, should they be negative, should they have a negative impact or effect on our program, or they can be opportunities, should they have a positive impact or effect on our program. Having said that, we need to not necessarily track context indicators in new plan, but be aware, identify them and be aware of them, and just to be used as a reminder of what to look out for. So we've given you 3 examples of what context indicators can be. For instance, you have a government that is formed within 3 months. This has implication on your program intervention and on your pathway of change. The government is formed, then it means probably that you have to develop new relationship with new staff. You have to build the capacity develop new government staff. So this will potentially positively or negatively affect your program. So you need to be aware of, and you need to track this external influence. An NGO Act is not repealed. Should an NGO Act be repealed, it means that we have less space to intervene within the country, and probably we need to rely more on civil society work, or further continue building the capacity of our SCO partners. By the same token, if, let's say, UNICEF enters into a partnership with the government to review a Child Act, this is an opportunity for us to become to have a stronger double voice in the demands that we make regarding the Child Act that is being developed. So these context indicators, we need to be aware of them. We don't necessarily need to track them, but we need to be aware and we need to use them as a reminder of what to look out for in our operating environment. Next slide. Then we have progress markers. Progress markers are the indicators that will tell us that we are on the right track, we're on the right pathway towards our ultimate end goal, or towards our ultimate big system policy change for children, and towards our reaching our child rights objective and outcomes for children. There are indicators to track progress against the critical junctures and other key intermediary changes. They can relate to soft capacity change, for instance, attitudes or relationships. They can relate to hard capacity change, changes in structures, procedures, technical skills, or they can relate to big system change if we are, as we go further along towards reaching our end goal for children. Maybe it's a new constitution, or maybe it's a Child Act that has been passed. There can be multiple markers to assess reaching a key change. They can be qualitative or quantitative, word and subjective experience versus numbers. They can be light touch or more in-depth, a speech quote from a government official, pre and post capacity assessments. But what we want you to remember as you are developing progress markers with country teams, program teams, is that SPEL is not a prescriptive methodology when it comes to identifying these intermediary level indicators or progress markers. Program teams are very much free to select the progress markers that best reflect that the critical juncture has taken place. We, however, know that the progress markers in our CRG, in our advocacy, and our campaign work, they can relate to evidence generation, capacity development of both duty bearers and rights holders, community mobilization, public awareness, coalition partnership building, advocacy, contribution to policy solution, contribution to policy implementation. So when we orientate and train on SPEL, we make sure the teams understand that the progress markers must be linked to this program path or tactics, to these, categories within those intermediary changes or critical junctures. There are some examples of what progress markers can be. For instance, Child Rights Working Group within the Human Rights Commission has developed an action plan by a certain date, or local health officials have the capacity to use new registry database. So for instance, here you have an example of a hard intermediary change in relation to technical skills. The Ministry of Education endorses Save the Children's position paper on inequitable budgeting. This brings us a step closer towards maybe policy change and towards reaching our child rights objective. So it's important that we are documenting, we are tracking those progress markers to enable us to tell a story about what progress and results our programs are having in the immediate to longer term. I have other examples of progress markers for you. For instance, empowered civil society, child rights organ coalitions, children's groups, children, communities, based on capacity development, sensitization that we might have imparted, change relationships between right holders and duty bearers, based on perhaps the culture of dialogue, constructive dialogue that we have built between those two stakeholders, changed attitudes or practice of duty bearers regarding child rights, and this is often, a precursor towards more favorable child rights policies and structures. Increased engagement from civil society or duty bearer decision makers on child rights issues. Again, we can consider this a key step towards an improved child rights environment. Commitment to change in child rights governance systems or structures, down to then we get closer to our ultimate child rights objective. Maybe low policy budgets are changed for the improved realization of child rights, and these same low policies budgets are resourced and implemented for children's rights. So this is what we call progress markers, these intermediary soft, hard changes that we encourage teams that have been trained on SPEL to develop and track to ensure that they are in a position to evidence the progress that they're making and results in the short to medium term. Next slide. Just on how to develop progress markers with participants. You will go through the monitoring slides with participants. You will reconvene the groups as per step 2 and ask each group to come up with progress markers against their critical junctures. As mentioned, there can be as many progress markers as is relevant to the program, to the tactic, to the path that is sought. And in plenary, you will present the progress markers and discuss the progress markers that have been chosen. Next slide. Now, the second element of our monitoring process is a simple tool, a very simple progress tracker tool, as I mentioned, to document progress and results and changes in the short to medium term. Teams should regularly monitor and report on progress and results. Data means nothing if it's not used. And essentially, teams should not rely on institutional memory, should not rely on remembering actions and results that have taken place 3, 4, 6 months ago. So the progress tracker will help you easily store and retrieve program monitoring information. And the progress tracker should be implemented on a very regular basis, so we don't lose that very important information on results, on progress, and on those intermediary changes that we are bringing about. The progress tracker helps us summarize, safely store, and easily retrieve key program performance and results information. And it summarizes the critical juncture and the associated progress markers, the progress that we have made towards these markers, so the changes that we are bringing about, our contribution to those changes, and allows for reflection and learning on reaching the key juncture, the milestones, and the changes. Next slide. The progress tracker will help you generate learning by answering the following questions. What has been the most significant change? This question will help program teams reflect on whether they have achieved their junctures, their milestones, their objectives, and put these changes in perspective against the external environment to explain why the change might be significant and why our contribution to this change might be significant. The next question is around our contribution to the change. Assess the significance of the work that has been implemented, given the context and the work of others, and can help us reflect on whether strategies should be reviewed. For instance, should our contribution to the change be low? And the last question is on the learning, on the reflection. So what changes do we need to make given progress and the context? Given the progress, is your pathway of change still the most relevant? Are the next set of planned activities still the most appropriate? This question helps you critically assess your plan of action and propose changes to improve it, and ensure you reach your end goal. Ansi, you want to take the next slide?
Yeah, I'll just present. I just want to show how this progress tracker looks in practice, and we can share this the Excel as well for wait. Can you see my screen?
Yeah. It's loading, Ansi.
Yeah.
Yeah, it works.
It is working?
Yep.
Okay. So just to identify those key questions and how you can store this information, to give an example of how this progress tracker using this methodology would look like. So you have the critical junctures, those diamond shapes that you derive from your pathways of change. And then you identify a target group that is relevant to that critical juncture, if relevant. And then what Camille was discussing around the progress markers or indicators for various pathways of change. So you could identify what are those progress markers or indicators in relation to that. And then you could log if your progress has been high, medium, or low. When was the date that the progress was logged? And those key questions that Camille mentioned. So the first question is describing the most significant change in relation to your progress. The second question is, what has been your contribution to the change? And then you can mark your contribution is high, medium, or low based on evidence. And what you have is also a log of evidence of these changes. So you don't need to, what Camille was also mentioning is, you do not have to just fixate yourself into institutional memory. What you do is, as you log these progress, you need to identify if there is any evidence to claim what has happened or not. And even if things have not happened, what are the enabling and hindering factors to achieve or lack of change? So what were those factors that helped you to achieve those change, or what are those enabling factors, the hindering factors through which the change did not come up? Is there something?
Yeah, but it's taking care.
Okay. And the next question is the learning question. So what? Why was the change important in relation to your critical juncture? What are the specific learnings from the progress? And what changes do we need to make, if any? So you need to reflect back on your critical juncture and say, okay, we haven't made enough progress on this, but we need to take into account, we need to change our pathway. So this is just a template of how it looks like. And I will just show you one example from Zambia on a failed progress tracker, where you have identified all of these changes in relation to that. And what you do is, for instance, I'll give one example. So one of the critical juncture is that communities are able to actively engage on child rights. And one of your progress marker is, the first is around capacity of the communities to engage. So you're strengthening the capacity. And you've marked the progress as medium because there's been some progress, but still some work to be done. So you identify the change in relation to that. You identify your contribution in relation to that. And then in the so what question, you identify that there's still some work to be done. So you need to develop some simple tracking tools to enable community to capture the engagement process. So they have the capacity, but they still need something else. So you go back, and this is what will become your next step. And then you see progress in relation to that. So you can have like an empty slot here that you just bring in your learning from your so what, bring it into your critical, in relation to your critical juncture. Okay, this is the next step. This is what we need to do. So you constantly log those progresses in relation to your critical juncture and seeing, okay, if whether a critical juncture has been met or not. If the progress achieved in relation to the critical juncture is green, or is it yellow, or is it red? And even when it is red, you might be able to identify that there's something that is not happening. Maybe it's because of the external influences, or maybe it is something that the work has not started. So this progress tracker is a practical tool to basically help you in terms of logging and monitoring. It's a monitoring log for looking at progress in relation to your critical juncture. So from where we started, from the strategic thinking diagram to developing the pathways of change, identifying critical junctures, identifying progress markers, this helps you to store all of that information in a systematic way. But we will share this with you. I'll just go back to the presentation.
Thanks, Auntie.
Yeah, one sec.
We're on slide 44, sorry. Yeah, perfect. So just out of practicality, how to develop a progress tracker with participants. We estimate this takes 2 hours for a SPEL training. So you go through the progress tracker slides with participants. You reconvene the group as per step 2 and 3, and you ask each group to fill in the progress tracker with their identified critical junctures and related progress markers based on program progress to date. So if the program is already being implemented, then teams will be able to start filling up the progress tracker. If they're not, then the progress tracker will just be populated with critical junctures and progress markers. Then in plenary, you present the progress tracker and you allow for question and answers, and you also review the tracker, and you can suggest data collection methodologies. Next slide. In terms of data collection, I mean, again, the SPEL process is not prescriptive. We can use all the array of qualitative and quantitative data collection methodologies that we know. However, we wanted to emphasize specifically, when it relates to advocacy and campaigning, that, scrapbook, quotes log, meeting observation checklist, media tracking forms, policy tracking analysis, after activity reviews, focus groups, social media. These are all relevant data collection methodologies to evidence results towards our critical junctures and associated progress markers. Next slide. Right, this is the last step within the SPEL process, learning for dynamic programming, advocacy, and campaigning. As we know, learning doesn't just happen. It must be actively sought and planned for, especially if it is to influence planning. Learning leads to knowledge, which should lead to improved action. Next slide. Again, we're not reinventing the wheel with our learning methodologies with SPEL. We just highlighted some of the learning methodologies available for our CRG teams so that there is an uptake in using them. So this is why we chose the following learning methodologies, and why we basically emphasize on them. So we recommend the following learning methodologies: feedback cycles, review learning meetings, process or impact case studies, and evaluations. Next slide. Okay. There should be a feedback cycle within both the strategy and the program MIR plan that will feed information on monitoring back into the review and adaptation processes of the program. So feedback can be sought with staff, program partners, program participants, children, communities, duty bearers, influencers. They need to be involved in these feedback cycles to make sure that whatever information we gather, whatever results we think we are having or we're making, that we validate this information with them. And that it also allows us to have a mechanism for validation and adaptation and development of corrective actions should our tactics, our paths not come to fruition. So we can, for example, ask for feedback after strategy setting to ensure our strategy is the most appropriate to achieve our end goal. We can ask for feedback after baseline work to share findings for feedback and validation. We can ask for feedback during regular monitoring to present monitoring findings for feedback and corrective actions. We can ask for feedback during more in-depth review to present monitoring findings, key learning points for feedback and adaptation. Finally, we can ask for feedback after endline or evaluation processes to share findings for feedback, validation, and final lessons learned. Next slide. Then we're recommending that more in-depth review learning meetings takes place, maybe against some of the key critical junctures that your program intervention is meant to reach. It allows us to schedule specific reflection times, and they should involve key program staff, but also partners and other key stakeholders, program participants. And during those review learning meetings, the following questions should be explored. What is our key learning to date? How can we apply this learning, and what will we do next? Of course, we should use our pathways of change, our program plan, our MIR plan, and our progress tracker to reflect on successes and setbacks, and really look at whether our pathway still makes sense, what have been the obstacles and roadblocks, what tactics need to change, and for instance, what are the key indicator progress marker data telling us in order for us to adapt, change pathways, go back one step should expected critical junctures and those changes, those intermediary changes not take place or not take place as we planned, or should hurdles have come along the way. Next slide. We're also recommending the use of process impact case study to explore and document current issues in their real-life context, and to allow us to answer the what, how, and why questions on specific CRG, advocacy campaign, but also other thematic change processes. Specifically, what happened? How or why did it happen? Who made it happen? What are the results? And what are the next steps? We want to highlight the very, very good and comprehensive process case study template that Save Children Norway has developed to help CRG team design process case studies. We will share this template. We have actually within the global theme used the template on several occasions to develop process case studies on specific areas of our work, and they are very good, of course, communication, but also reflection tool, and stimulate learning within our CRG community. Next slide. Then finally, we highlight evaluations as a learning methodology. I mean, unfortunately, there are not enough, in my view, evaluations carried out for, and rigorous, I would say even impact evaluations carried out for CRG programs, unfortunately. And we want to change this trend. I mean, evaluations are systematic and objective assessments of projects and their design, implementation, and results to determine the relevance, fulfillment of objective, development efficiency, effectiveness, impact, and sustainability. Of course, information that is collected through SPEL will drive the evaluations. We can also use this opportunity to include some of our thematic research and learning questions where possible. I mean, the bottom line is that we would like to stimulate the use of evaluations, and more specifically external and impact evaluations. We need to make sure as CRG practitioners that we include evaluation lines, for instance, in our budgets, and this is unfortunately not done enough within CRG programming. And I'm calling here to my fellow member participants, yes, to see if we have some windows of opportunity to include those evaluation lines within our CRG budgets. This is all we wanted to tell you with regards to SPEL processes and tools. Now we will focus on giving you practical examples of how to integrate SPEL in meal systems and how to develop SPEL action plans for SPEL trainees. Hansi, you want to take over?
So just some practical and very basic steps on how you can integrate SPEL in your existing meal system. So in developing your strategies or proposal development or in your meal plans, that is where you can integrate, the use of critical junctures, the use of pathways of change and all of that. You can use SPEL and the progress tracker as regular monitoring routine and a monitoring log. You can use SPEL in reporting because the progress tracker helps detail the narrative around whatever various donor reporting you have, the country annual report you have, so it will help you gather all that information in a systematic way. You use SPEL for evaluation. It can guide your evaluation questions. It can verify your narrated results and also help the evaluator to see the change process. So you can use it for your internal evaluations or for external evaluations, or also for validation of your narrations. Use SPEL for accountability to children, to communities, even to your donor, or to different stakeholders. You use SPEL as a learning tool, the whole feedback cycles and all of that, adapting your pathways of change. You use it for that. And in the end, what it is important to emphasize again is it's not replacing the current meal system. It just strengthens your meal and takes all of these factors into account. When you're demonstrating long-term changes, it helps you to document those intermediary changes and everything. So these are some practical ways of how you can integrate SPEL within your existing program cycle. What I'll show you right now is if I can just show my desktop again. You can see everything on my screen. It's all right. You can see my screen? Yeah. That's all right. So just to highlight, you know, when you're developing your result structure or your meal plan, you can add specifics of SPEL within your meal plan. So this is just to show in terms of your result structure that a progress tracker is there that contains progress markers which will be updated regularly. There are critical junctures that will be developed in the inception phase or will be done in conjunction with the program and how they will be monitored. So you have, for instance, your quality benchmarks, your accountability mechanisms, activities, and everything. But you can add aspects of SPEL within this. When you have your review meetings and feedback cycles, you have learning and review meetings where you look at the progress tracker and the critical junctures developed. Does it still make sense? Where have there been obstacles and roadblocks? What tactics needs to change? So there are aspects of SPEL that you can integrate within your different within your meal plan, your result structure. So this is just one way of presenting how you can, when even for different proposals or different donor reporting where you are developing your meal plan or where you're developing your results framework, you can integrate aspects of SPEL within those. So that's just one way of showing that this is how it's integrated. And I go back to the presentation again. Yeah, Camille, you want to continue now?
Thanks, Nancy. So the final part of the SPEL training focuses on developing a SPEL action plan together with trained teams. I mean, they're often meal and program teams. So we reflect together on what needs to be done to basically implement SPEL and bring SPEL forward within the programs. So often it revolves around finalizing the different SPEL products which are at draft stage by the end of the training. So finalizing the SPEL product, finalizing the strategic thinking diagram, the flow charts, having finalized identified progress markers, starting populating the progress tracker. We also are often asked to actually share SPEL within senior management teams, just to dispel the myth that SPEL is an additional or is a duplication of other existing meal systems. And then, I mean, we often ask for follow-up in terms of receiving updated progress tracker to make sure actually the SPEL tools and specifically the progress tracker is used. This is, I think, all we had to talk to you about SPEL today. Anzi, is there anything else you want to add before we move on to the Q&A session?
No, I think this is fine. We can get on to question and answers. We have some 20 minutes left.
Yeah,
I think.
I mean, there's just a couple of final points. So thank you very much for attending this session. As we mentioned, we need commitments. We need support across the organization to further socialize and roll out SPEL. I hope really this came across as SPEL is cross-thematic, SPEL is cross-functional, and that it will benefit, you know, it integrates, it's a set of tools and processes within SCI's meal framework. And I really hope that participants from the Global Campaign and Advocacy team, from Aditayo, from the Global Health and Nutrition team, I really hope you see the value addition of SPEL. And I would like to know if you are interested and if you would be committed to supporting us in further socializing SPEL. I think the next step for us, obviously this is just an orientation, you know, with interested participants, we will go further, probably a more in-depth training, we have a general guidance on SPEL available. We will be developing a training of trainers guidance on SPEL. So hopefully with all these products, we will be able to add key technical resources to support us in socializing and further rolling out SPEL. Yes, shall we go on to the Q&A session?
Yeah.
Yeah, so I have noted a question, first question from Alioka, who actually had to leave. Alioka was saying that in the interest of high-performing organization and reducing complexity and stress, how do we combine SPEL and, for instance, the advocacy impact reporting tool? And then second of all, how to link this to mainstream meal function of the organization, as measuring and learning is really meal-driven function. I would say, as I mentioned, SPEL offers a series of tools to enable you to report on progress, results of your interventions. And this storing of information and documentation on a regular basis will feed into the information that has to be reported against the advocacy impact measurement tool. So, I mean, the SPEL tool processes and tools, they are supporting I think this is key, the storage and the documentation of relevant, immediate, mid-level result changes that feed into reporting processes of Save the Children, of donor reporting, and so on. So they're just tools, as Luc mentioned, within a toolbox to help you better, provide evidence or write a narrative of results and progress.
Yeah.
Antti, you want to add anything?
No, I think it's just to emphasize on that this helps you to store intermediary changes and record those changes, and when it happens, rather than looking at it yearly and see, okay, what did you do? So it helps you to document those mid-level changes that often are missed out, and also to make sure that the complexity and the context is taken into account. So if things haven't happened, it's for a reason why it did not happen, and what were those reasons, to be able to communicate better around these. So that's important to look at.
Great. I've noted a second question from Alana on program knowledge. I'm not sure what you were specifically referring to, Alana, when you were asking whether it's specific knowledge about country-specific program or program planning in general. Alana, if you're still with us, you want to take the floor?
Yes, thank you, and thank you so much for the presentation. It was actually in an earlier slide, if I recall, it was things that trainers require in order to do this work, and there was a brief bullet point, I can try to find the slide, about program knowledge, and I was just wanting to dig a bit deeper specifically into what you were referring to there. That was all.
Yeah, I can take that. For instance, for a previous program, because SPEL builds on for you to understand about the complexities, context, program analysis, and everything, your child rights situation analysis, your child rights governance assessments are different. So that is what this program knowledge is referred. So when you're identifying your intermediary changes to lead towards your ultimate goal and identifying those child rights governance dimensions, you need to also take into account what is the opportunity structure that looks like, and what are the hindering factors that currently are standing in within. So for that, you need to have a good program knowledge, or you need a good analysis to support that. Okay, what are the assumptions that we're taking into account when we're saying, okay, this works and then this will happen and then that will happen? What is the current modality that we're operating on? What is the current complexities or the current scenario? That, okay, now this is the government that is not receptive or not taking into account or has different priorities in that agenda. How do we work around it? So it basically is just, yeah, you need to have this existing knowledge and experience and build up on that, rather than, so for instance, whenever we even talk about learnings and evaluations and all of that, so the whole planning process needs to take into account those previous learning. evaluations or assessments and analysis, and build your program on that. So rather than coming up with something and building it up on something. So that's what the program knowledge refers to. Yep.
Thanks, Andy. Then there's another question from Alana on whether partners or children's organizations also benefited from the pilot training. Yes, they did. Actually, partners, children's organizations, both in Zambia and in Peru, were trained on SPEL. And I must say, they are the ones who found the approach most beneficial in terms of both. I mean, it often comes back when we train on SPEL. Quotes from participants say, "Oh, it allows us to account for failure, right? What we might consider failure, but that we need not want to acknowledge in the past. It allows us to account for failure, to account for strategies that don't necessarily work, right? And then also the feedback that comes from partners that it simplifies so much M&E methodologies. So yes."
Yeah, and the diagram that the picture that you saw with the communities that are using and running with this, so it also helps them to identify, okay, within this structure, within this child protection committee, this is what this is the change. So this pathway of change or this visualizing helps them as well, and it's very easy for them to demonstrate where we are and everything. And what we got from the pilot is this supports the participatory monitoring and evaluation. So when we talk about all of this social accountability, or when we talk about all of this participatory approach to planning and monitoring, this methodology supports that to a greater extent and makes it useful for the communities and the children to make it practical for them as well, rather than big tools and big databases and all of that. Yeah.
Great. There's a question from Chana on what are the key feasible and practical learnings from the pilot in Zam and Peru, and what aspects could easily be integrated into the meal systems. I mean, for me, first and foremost, since the Zambia pilot, we have reviewed the language that we have used in SPEL. We have still clear from calling it an approach or methodology. We emphasize on the fact that there are tools and processes, right? And tools feed into the wider SCI meal framework. For me, that's one of the important learning. Also in Peru, we had to be wary of the language, unfortunately. Yeah, so we need to further translate and the tools in language that are common in our CRG programs. Anzi, you wanted to take the second part?
Yeah, to add on to that, I think what we need to be wary of, it could be too overwhelming as well. That it's there's a lot there, from the start to from the strategic thinking diagram and all of this, yet another tool. I think that we should be wary of, and just make sure that there are aspects of SPEL that can be integrated within your existing systems to strengthen that. And that is the emphasis, and that is the focus that we need to bring forward again and again. And just on your question, Janae, on how what aspects could easily be integrated into the meal systems, based on experience, and right now what we've tried to do is we've made it like practical examples of using the strategic thinking diagram to develop your theory of change, for instance. So it just supports and strengthens your looking at different dimensions. Looking at the results framework that we've developed for the CEDA CSO application. So it supported that strategic thinking diagram and developing the pathways of change. Rather than just specific flowcharts, what people did within their proposal process was develop a narrative around it, but still taking into account all of these. So we also need to check the feasibilities. And then there are some people are actually, doing it, visualizing it in terms of flowchart, or trying to, develop these aspects, the critical junctures, into their existing management information system, for instance. And then there are aspects, for donor reporting, for the country annual report. There's a need for continuous continuous monitoring and documentation that supports you in these in giving a solid quality report. So those are the aspects that this progress tracker, for instance, helps you to document all of these changes, that in the end you are just able to filter, compile based on your different outcomes or based on your different stakeholders or based on what the risks and assumptions were associated with that. So basically it's just a it's a practical tool that guides and strengthens your existing functions that are already there, rather than creating a separate function. So that is what we need to be wary of. These are the things that are, and also one important aspect that we need to be wary of is also that it connects program and meal together, rather than keeping it separate. Brings people together in terms of visualizing, looking at things, looking at all the operational aspects, the programmatic aspects of how things are happening or not happening. So it's also connecting people together through this, and also the partners, communities, and children together. So that's the aspects that we need to take into account of, and just make sure that to emphasize that this is not something that you follow from A to Z. Depending on where you are in the process or what you're doing, is you could build it up into that. Like for when you're developing your proposal, maybe you just need to look at the strategic thinking diagram and see how are we looking at that, and how have we taken into consideration different things and stuff like that. So that's an important aspect. Yep.
Thanks, Nancy. Then there's a question from Luke on how is SPEL linked with the child protection's pathways of change work, violence against children? Nancy, do you know about that?
No, I think this is the term that has come up just quite recently after the SPEL. So I have no idea how those pathways of change are talking about, because it's the same thing as the whole Save the Children theory of change, how that takes into account, because that's an organization's theory of change, but this is looking at the programmatic aspects of that. What we've also seen is a lot of different proposals where the theory of change diagram that Save the Children has is built up into different proposals without taking into account what is this program theory. So we need to keep that separate in terms of what the pathways of change is for a specific program or program component, and looking at it from different aspects. So this might be a confusion or something, but we need to check what that is. I've just heard about it, but I don't know what the whole...
Yeah, Angie, this is Luke. Just to say, I'm also not familiar with it, but just to say, in this particular case, I'm sure it's not a confusing. So it's actually filling the same gap as SPEL is trying to do, in that, like, we have our kind of fixed log frames, we have our theory of change, but what do we say in terms of the pathways of change, what decisions need to be made based on whatever data, like those diamonds that you had in your presentation. So I think for the child protection one, it's a similar exercise. So I think it's good actually to check what the linkages are, so that we are clear when we're talking about the pathway of change, that we're clear what we're talking about.
Yeah, thank you. And now it would be good to link up to that and see what is it that so that we do not invent different stuff, and rather what Sarah is mentioning, have they used this process or is it something else? Good. So it's good to check that. Yeah, thanks.
So we had invited our global thematic meal counterparts to this orientation. Unfortunately, besides Aditayo, the other guys could not make it. But I mean, we share the recording, and we make sure to discuss that specific those linkages with the child protection. There's a question from Stefan on when will the TOT guide be ready. I don't want to make any commitments as I'm leaving myself. I would say shortly. Andy, do you have any idea? No. I think we need to discuss that with Hagar and.
What we have right now is a training of trainers, sort of a presentation with some aspects, and what we have is a pamphlet and a guidance document. So it should be a simple exercise and not something that is too complicated. So even right now with the documentation what we have and the presentation, I think something could be created in terms of simplified, what you were mentioning, simplified training for for TAs and others around. So, but that should be something that we need to take forward in the global theme. Yep.
Yes, but yes, Chane, we have training slides that we have available when we impart training, so we can make those available. They are a simplified version of the presentation we just gave.
Yeah. Any other last questions or comments? And just to add on to that, if there's any other questions or clarification that you couldn't think of right now, but you would want to be clarified or something, feel free to send me an email, and I'll be happy to respond on that.
Wonderful. So if there are no more questions, then thank you very much for participating, and apologies for the short notice. I think we will be in touch, we as CRG Global Team and Save Children Sweden, with you very soon on the next steps. And thank you very much again for participating, and I wish you all the best. Take good care of yourselves. Thank you, Anzi.
Thank you so much. Thank you, everyone.
Bye-bye.
Bye-bye.